My name is Claire Macaulay. I'm a breast oncologist and I work in the west of Scotland in Glasgow alongside Alison. And stories like Helen's are somewhat heartbreaking for me, I think, in that we go into this job to do the very best for people. I went into this job to support people to come out the other side to live long and healthy lives. And it was only when I started talking to people and asking the experience afterwards, realising that Helen's experience, which is actually when I leave you and the safety and comfort from you and I go back into my real life, actually things might often be quite worse than they were through that whole period when I was having chemotherapy and having a difficult time. And that took me to become interested in what was happening to people after the event, after they left the safety and comfort of my experience with them. And what did it really mean for their lives afterwards? And what was I doing if I was leaving people with the endless experience of their life after cancer, having got them through maybe the 9 or 12 months of their oncology treatment? What did it mean for them afterwards, and experiencing and understanding that people's experience was often significantly life-changing. And that took me to doing some training around menopause. My particular area of expertise is around sex and relationships after menopause and after cancer treatment, and that took me to training as a psychosexual and relationship therapist, which I use in my clinic room alongside my oncology treatments, because your lives matter after cancer. I think it's often the sense that getting through the initial cancer treatment is the bit that's important. Keeping you alive is important. Well, what is the point in me keeping you alive if your life is utterly miserable as a consequence? And so the difficulty then lies is, well, where does the responsibility lie to catch all of that? Is it a breast surgeon? Well, what more does a breast surgeon know about menopause? Is it the oncologist? Well, their job is to get you through safely the oncology cancer treatment part of it. Is it your breast care specialist nurse who's trying to cover all of those things? And the truth is, or your GP ultimately afterwards, and that's often where things end up ultimately, is with your GP, who is no better informed, or not necessarily informed. They're looking at your healthcare in a holistic way, but they're not speciality trained in oncology or cancer or anything else either. So how does that gap get filled? And of course that's where Danny and today's day comes into, is that we need to be starting to think in a much more joined up way about what it means to be a thriver after cancer. What does it mean when you leave me and the comfort of seeing me every week or every 3 weeks or whatever your chemotherapy is, and there's something around that it is often at the point in time where people leave their initial acute services that they start to fall apart, because the enormity of their life-changing experience that comes after that without anyone to catch them. And so that's where organisations such as Danny comes in. It's why those of us in the room are such big supporters, because we know that there is a massive void in terms of what happens to you after you've had this experience. And we can do something about that. We can train healthcare professionals to understand a little bit more about the treatments that they're prescribing and the impact on you. I know there's unlikely, if you come to have oncology treatment with me, that you're going to develop a side effect that I don't know about, or you're going to develop a side effect I can't help you with in relation to your chemotherapy. We should be thinking about menopause and the menopause treatments and the hormone treatments that come afterwards in the same way. How do we manage those symptoms? How do we make life bearable? Because we know that about 50% of people will never finish the treatment that they started. They'll never get to 5 years. It is in our professional interest to help you to be able to stay on the treatment, because we know that the treatment improves your outcome in the long term. It is in our interest to understand how to support you to stay on your treatment, because I do understand how scary it can be to stop your treatment, knowing that that's not the advice that you've been given, with all of the uncertainty and all of the scary prospects that might bring. And so calling for change today in terms of us all working together. Ultimately, when you come into the consulting room, there are two experts in the room. I am the expert in your treatment, and you are the expert in you and your life and what's important to you. And we need to support healthcare professionals to be able to have those discussions with you so that you can make decisions that feel right for your life. And that's the point of today. And great thanks to Danny for filling that void and that space that you need to be able to live long, healthy, happy, productive, joyful lives after cancer.
Thank you, Claire. In lots of our media interviews today, we were asked who holds the responsibility, and at no point as an organisation do we ever want to point a finger at anyone in this picture, because we are just where we are at, right? It's not ideal, we know that, but it's not anyone's fault. But we also do know many oncologists are quite reluctant to listen to us and to have these conversations. How can we encourage them? Because I also know you have very little time. In the few follow-ups, you have very little time to talk about all of that. So how could we improve?
Like a lot of things, we can't be experts in everything, you know, and I think a lot of the reluctance comes from not really knowing. That's the honest truth. I think if we were genuinely honest with ourselves, patients asking us questions that we don't know the answer to doesn't make us feel very good. And so often some of that is around understanding, it is about education, it is about knowing, am I the right person for this? Do I really have the time to go into this just now? Because obviously each part of, or the team, if you like, that's surrounding you on your cancer journey has their own area of expertise. And we need to try to start to think about, well, where do we hold that expertise in terms of life after and what that actually means. And I think the patient voices and patient advocacy is hugely important in all of that, because you know what it's like to live with it afterwards. I don't, it's not my lived experience. And what matters to you matters to me. And also what matters to you might be very different to what matters to you. So understanding that we really need individualised care, because there are some women come in and tell me they've got no problems whatsoever on their AI. It's not, you know, so we have to be able to understand that everyone has their own individual experience, and beginning to understand how we can sort of pull those threads together so that everyone can get access to the care and support that they need.